Hey, welcome to my podcast. My name is Dr. Brendan McCarthy. I'm the Chief Medical Officer of Protea Medical Center in Tempe, Arizona. Thanks for tuning in to the podcast. I'm glad to be here, and I'm glad you are here. Today, I am going to continue with my series on self-silencing in women and the impact it has on your health. It's not an easy thing to discuss. Self-silencing is something that women have been culturally conditioned with, and it is a triggering thing to discuss. It is a hard thing to talk about. I kind of stumbled into this conversation with you in the podcast because I wanted to drill down and provide material for men to give them a way to communicate with their significant other when they were going through PMS or perimenopause and menopause. I wanted to help men understand women as they navigate through that transition. And I am qualified to do that because of what I do and the amount of years doing this. And I feel as a man, it's an important thing for me to acknowledge what women go through, what their experience is as I see them. It is a way to provide further validation to women that they deserve that validation, and you deserve advocacy from men and women for you. So I feel very comfortable in this space speaking to men about how we show up with the women in our lives when they have PMS and how we show up for them when they're going through endocrine disruption. And there's a certain point that medicine can treat. You know, that's true. We know this. But then there's a certain point where, as a physician, I need to point out where cultural things or lifestyle things are impacting your health and causing a medical condition. So there's an overlay with lifestyle always in medicine. We know that. And I step into that space with my patients all the time in a preventative tone. That's my job, is to be preventative with them. And so I discuss these things. So, when I was talking about men dealing with their significant other in terms of PMS, I started talking about silencing the self, which is something that women do. Silencing the self has been with me in my practice since I first opened the door. I didn't always know she was in the room with me. She's been there the whole time. Women have been with me all of these years, and I haven't always addressed it by name because I didn't always know it by name. I had to get to know her over time and what this is. But when you have a patient presenting to your clinic, with cortisol irregularities and with, a host of other biological symptoms, you have to be a good doctor and take a good history. And like good history means like, what's their social history? What's their support systems? What's their life like? All these years practicing, it's difficult because you'll have a patient come in and she'll just say, I'm fine. I'm not stressed. I can keep going. There's nothing wrong with me. Meanwhile, her cortisol is very low. Blood sugar can be low. Insulin is high, and she's gaining weight. I use this example a lot because it's an easy one to point out. But also you have patients with hypertension and fertility. It's not monolithic to just weight. And the thing about self-silencing is it's like you're trained to think that that's normal since you were little. And silencing the self has become such a normal part of our culture and just accepted. It's like men don't cry, we know there are a lot of unhealthy things put out there for us, and we just accept them and we think they're normal. And if anyone steps away from that, you're punished culturally. Like, if a guy were dare to cry, he's no longer really a man. There's a lot of foolishness. And I would say that silencing the self is one of them. There's 4 categories of it that Dana Jack published in her her research around this. I'm a big fan of it. And I remember reading this book she published. It really is a moving thing for me as a father of a daughter, as a husband, and as a man that works with women every day. And it's important to know and not to welcome self-silencing, me to really actively do my best to find the voices of the women that I work with and create an environment where they feel very safe and comfortable communicating how they are and how they feel. The things about self-silencing that you may recognize, you'll see, externalized self-perception, which means that when you only view yourself through the lens of how other people perceive you, you only see yourself in terms of how would they see you. It's an externalization of self. You're no longer looking in the mirror and seeing yourself through your lens of how you want to be. It's more about how you perceive other people will think of you as. It's how do they see me? How am I signaling them? How am I projecting out into the world? And do they see me the way I want them to see me? It's not a matter of, do I want to be me? Do I see myself? It's more like I see what other people would want to see in me. So it's a very unique thing. It's very important. And so that's how you compare yourself with your looks, the types of clothing you wear, how you speak, how you move through the world, the weight that you carry, the work that you do, the children you have, the marriage, the family, all these things. We judge ourselves based upon how we're perceived by others in these areas. It's one of them. The other one is silencing the self. Is the actual term silencing the self is when you are, in order to preserve your relationship, you don't speak up. And that is so profound. There's a truth where there's some places where I'm going to, hold my tongue. I'm not going to say something because this is not going to go well. I know that. And there are times you really do need to, hold back and not communicate certain things because this is not the right place to do it. It's only going to escalate it. True. But if the whole tone of your life is that you don't speak your mind because you want to avoid any kind of conflict, because you're perceived as your values perceived on your being docile or agreeable, that's not healthy long-term. That's another way that you're suppressing who you truly are. You're inhibiting your true presence, because it's okay to have a bad day. It's okay not to agree. But it's remarkable how many women have been conditioned to be in a space where they're not allowed to oppose or be oppositional in any way. Third one is divided self. That happens a lot, and that's sort of variant on these things. But there's internal conflict. You have the authentic self, who you really see yourself as, who you truly are. But then there's also the person you have to project to the world outside of you. You have to wear two faces. This is your true self, and this is the person everyone sees, because you don't feel that you, as who you are, is welcome. It could be maybe your sense of humor, your identity, your opinions, your politics, your beliefs, your taste in music. You know what I mean? You have who you present yourself as self back here. This third. And the fourth is the one that I see dramatically in my population of women is care as a form of self-sacrifice. The only way to show people you really care about them is to sacrifice from yourself. And I use this example a lot because we talk about it at our office, and I've done it. We've all done it. But women tend to be conditioned to value it quite a bit. And it'll be sitting like, instead of having your own breakfast, you're going to eat the leftover remnants of your kids' cereal in the morning because that's what you did, and you eat the leftovers off their plate. That's a perfect example for me of what it is. But it's not taking care of yourself. It's not doing something that makes you happy. Your whole day is consumed by caring for everyone else around you. You're waking up in the morning, you're preparing breakfast, you're getting the kids lunch, you're making sure they're all ready to go, you're making sure your husband has his things ready to go, you're prepping for everyone's lives around you, you're cleaning the house, you're maintaining everything for everyone around you. Kids get off the bus, you bring them off to their after-school activities, you get home, you make sure they have dinner, you make sure they're doing their homework, you do the dishes, you fold the laundry. Where are you? That's that self-sacrifice. And when they come into the room with me and I see the stress indices and I see, their cortisol being off, I see all these other metrics, I'm like, what are you doing for yourself? How's your self-care? And they don't have any hobbies. Or maybe the ones they have are not very healthy. Maybe the social settings that they hang out with their friends is not really very supportive. It's more toxic because in a group, they're always comparing how they appear outward by saying, oh, my kid does this and I do this. They're basically signaling the first version of this where you're projecting, you're worried about how other people perceive you. Why am I talking about this? I'm not a psychiatrist. Not at all. I'm a doctor. I'm a naturopathic medical doctor. I'm a physician. I'm talking about it because you can't treat a person without knowing them. You can't be a good doctor without understanding this stuff and talking about it. I'm going to tell you about cardiovascular health and this topic today. That's what we're going to talk about. I've already talked about autoimmunity. I'm going to talk about cardiovascular disease. I'm going to talk about fertility next. I'm going to explain it, how it really works, because when you're under this chronic stress, and you may not even feel the chronic stress, you just see it on the labs, right? Because you've adapted to it. It's like a frog in a pot. You get used to the temperature. You just are used to being stressed. You don't see yourself as being stressed. This is just where you are. But that low-grade stress chronically occurring has serious repercussions. So when it comes to cardiovascular disease, let's go through that. When you're under chronic stress, measurable through like heart rate variability, if you're using like a wearable, like an Oura Ring or any one of those things, there's these different watches that test this heart rate variability. This is a way of measuring how stressed you are. Or if you see my labs, you'll see the cortisol levels have become blunted over time, and they have a diminished return. The rhythm of the cortisol is lower now. What that chronic stress has done over time, it's created a dysfunction in the hypothalamic pituitary adrenal axis. I just want to throw that out. Sometimes I like throwing out the science with you guys. I don't want to do too much because I don't want to alienate you, but I sometimes want to use it as a punctuation so you know I'm really serious. When you bathe your body with cortisol, so perceiving stress is fine. You're supposed to deal with stress every day. That's life. Healthy stress is something that happens, like you're driving, someone jumps out in front of you, oh my gosh, you step on the brakes, there's a cortisol surge that happens, then it comes back to normal and you're fine. The cortisol surge is basically preparing for a physical trauma. That's how the body operates. But if you're constantly stressed because you're constantly worried, you're constantly trying to speak a certain way and behave a certain way, maybe it's even like and some of us are raised in very strict cultural backgrounds where we, have to be morally a certain way, always perfect. You must be docile. You must be obedient. You're a human being, not a pet. You're not made for that. It won't work long. So chronically, it will stress you whether you want it to or not. And the cortisol will be high initially. And over time, your adrenal gland can keep up, so it's going to have diminished returns. And that's where you have that lower levels of cortisol. I test in the morning. And if I do cortisol times 4, which is a throughout the day testing, I'll see your cortisol not quite being where it should be overall. It's on the lower end now because you're now at a depleted state. It's maladaptive stress. So now your cortisol is low. But the period of times where it was washing up high, what was the impact that it had on your body? It creates more insulin resistance. Yeah. It fools around the middle corticoid, and it also causes endothelial dysfunction, which in essence, basically, I'm just saying it sets up the recipe for your arteries to become more stiff, less flexible. So you increase your risk factors for hypertension. And people say, well, I'm not stressed, because they perceive stress only through the lens of the person jumping out in front of their car. They only understand stress in terms of that abrupt, acute stressor. They don't feel the stress as a long-term lifetime of emotional suppression because it's happened since they were so young. So the first stages of this goes through cortisol. You're having this dysfunction with the cortisol. Again, hypercortisolism is going to create that insulin resistance. It's going to create irregularities in middle corticoid, aldosterone specifically, and you're going to see some endothelial dysfunction, which is the lining of the arteries becoming a little more rigid, less flexible. This part's the hard part. The second one is when you're in a constant state. So the first one was cortisol, right? And the hypothalamic adrenal cortisol impact, whatever I find. When you're constantly upregulated with stress, constantly being hypervigilant for your behavior, hypervigilant for your doing right or doing not doing right, and you become even hypervigilant for other people around you being good and not good, and following this self-silencing, this either this cultural purity, or it's going to be the identity you're supposed to possess, and all these different things. When you're doing that, your nervous system is upregulated constantly. Your amygdala is ticked upward, and you are more pro-sympathetic, meaning your sympathetic nervous system is upregulated and it's just turned up. When you're supposed to have some sympathetic turn up in your life. You're supposed to have, epinephrine fire up every once in a while at higher levels. Again, that's a part of the stress response. When you're driving on the car, someone jumps in front of it, you're going to have a cortisol jump, all right, from your adrenals, but you also have their sympathetic nervous system fire up. And that's the epinephrine. You're like, okay, I need to be super alert. That's neurological. When you have this constant vigilance and constantly training yourself to be constantly vigilant, your sympathetic nervous system gets locked in that higher state of stress. And that could be seen, again, using heart rate variability, using one of those monitoring devices like Oura Rings. I use that myself personally. But then there's the Whoop band. There's different watches that are good. But you'll see the person never goes from sympathetic back to parasympathetic. The nervous system, the heart rate variability shows a chronic state of stress because the person's stress levels are upregulated. When you have chronic stress like that, chronic firing of the sympathetic nervous system, that also impacts cardiac contractility. Your heart rate's going to be higher, but also plays a role in coagulation, increases risk for coagulopathies. But ultimately, it increases that tone of the sympathetic nervous system, cause your body never to have that relaxational state, meaning you'll always be in the state of almost pro-inflammatory, because there's inflammation that goes along with being in that sympathetic nervous state, and there is an anti-inflammatory component of being parasympathetic. And if you're never letting yourself go into the relaxed state, you'll always be in that sympathetic state. They'll never be in that recovery state, and that also has that direct cardiovascular impact. Further, one of the things that I keep forgetting to bring up here is nitric oxide. It's not just for men. We think of nitric oxide, people are like, oh, that's for, erections. It is, but it's not. That's just part of it, nitric oxide. Women need it too. And if you're under that constant sympathetic state, you're not going to be able to regenerate your nitric oxide. You're not going to have that vasodilation that occurs, again, hypertension. Over time, with that cortisol, going back to that, with it being elevated and then deficient, having that wash of cortisol over time creates that glucocorticoid resistance, similar to insulin resistance. If you have too much insulin, you eat too many carbs, insulin goes high, you create insulin resistance, you can create glucocorticoid resistance. And when you have that, the cortisol is your natural anti-inflammatory. And if you've been just flushing it around over time too much due to stressors, you're not going to have enough left, or your body will become more resistant to it. So that way, when you do have inflammation, your body really doesn't have a way to stop that inflammation, because your cortisol's been sort of either be rendered inert or not as effective because you created a glucocorticoid resistance because you've had too many surges of cortisol from stress. Or you have diminished returns. Your adrenal fatigue is so significant you can't even generate enough cortisol to mount an anti-inflammatory response in your body. So that nuclear factor kappa beta pathway is just clicked up, and you have these more pro-inflammatory cytokines are allowed, like interleukin 1, interleukin 6, tumor necrosis factor alpha. These are allowed to go too far, and you need them. You need inflammatory cytokines, but you also need the anti-inflammatory part. These chronic stressors have impact here, and they're starting to add up. You're hearing me in this. When you're under chronic stress as a woman, you're not going to ovulate very well, because that's birth control. That's born into you. When you're under stress, your body won't ovulate. It's just there's different mechanisms that push that pathway that way. And you've experienced it, or you have someone who's experienced it, where they're like, they were stressed out over something, they missed their period, then they thought they were pregnant, and then they're stressed out over that, and then they missed the period again, and now they think they're pregnant, but they're not pregnant, they're just stressed out. or other people who are dealing with infertility, and at the end of the day, the true cause of their infertility was stress. Those are all true and valid things. Stress does impact hormone balance and your ability to ovulate and generate progesterone. If you've ever seen me do a podcast ever in this life, you'll know the one thing I talk about the most is progesterone's impact on your brain chemistry and the beautiful role progesterone plays with anxiety. It is a beautiful GABA agonist. It binds to the gamma aminobutyric acid receptor in your brain. And it is my favorite because it is for anxiety. It is just good. It is good. And if you don't have it, your brain, no matter what, pushes towards anxiety because you don't have that effect of progesterone balancing out your more pro-anxiety part of the brain. You don't have enough progesterone to quench that GABA receptor and get effective anti-anxiety. What happens when you don't have progesterone? You're more anxious. What does that do? It feeds forward on the sympathetic nervous system, makes you more hyper-responsive. It is so hard to silence yourself when you have PMS. It is so hard to silence yourself when you have PMS. And that's why I said that in an episode recently. This is why when your significant other, your spouse is having PMS and they yell about something, this is a moment as a man, you're like, okay, what is this? Why? This is your window into that self-silencing with your partner. She may not have ever felt safe to tell you these things. This is why I'm doing this. Your body's not betraying you with this hormone shift. Your body's, doing its job. You're just not meant to silence like this. When you're raised culturally that your identity and you being a good person is built upon your cultural concept of purity or docileness or being obedient or looking a certain way, behaving a certain way, fulfilling someone else's needs, that's your value. You're more than that. You were made for more than that. There's something beautiful inside of you. And it's hard to express that when you have all these cultural repressive thought processes or ways of thinking put onto you. When you're a child, you don't have the ability to, assess the value of these ways of thinking. You just do it because that's the way you're raised. And this is why it's culturalized. I'm not doing this in order to be critical of different cultures or spiritualities or belief systems or religions. Not at all. I'm doing this to advocate for your health. Because there's a difference between following your cultural ideals and your healthy social norms and being suppressive to your identity as a human being and communicating who you are. There's a very big difference. There's a difference between pathology and normal healthy culture. I know it's inappropriate not to, it's not appropriate to go start yelling, I don't like this, I don't agree with you. That's not what I'm saying you're supposed to do. I know that. There are times you should not bring something up. There are times not. But the thing is, there should be a time when you can bring things up. It's important that you have that space to be able to do that. Women are far worse treated when it comes to cardiovascular disease than men are, and you have a higher rate of mortality from it. Unchecked hypertension leads to heart failure. Women have a higher rate of mortality from heart failure than men do. Just because this is an emotional thing doesn't mean it won't have physical consequences. And cardiovascular disease has a horrible way of sneaking up on you later in life. So when I have a patient come in and they're in their 30s and they have hypertension or they have high cholesterol and they have cortisol irregularities, and we talk about their stress and their sleep and their health and what they're doing, I know right away. It's hard for me to create for them a sense of urgency to change it. And a lot of times they'll be very resistant to me because it's almost like I'm poking at their sense of reality, their sense of value. There's a lot of terror because you feel like if I don't suppress myself like this, my partner won't want to be with me. They'll abandon me. Or use sense of self of like, people won't value me. I won't be welcome. It's a very hard thing to face this. But what we resist will persist. And I didn't write the book on this. No one did. It's just nature. It's just nature. And there's nothing we can do to change that other than acknowledge what the nature of who we are is and welcome that. The practice of good medicine is more than just prescribing a medication when you see a condition in front of you. The practice of medicine is understanding human physiology and pathology when it goes wrong. Physiology is how it does its job. Pathology when it does its wrong. That's medicine. Understanding the woman in the room with you is how you execute it correctly, is understanding that person and where they are in their lives and helping them navigate through that and showing them the results of that. That's it too. Further, medicine is not having a bias when you go in the room. I have no bias. I actively seek bias in my life to make sure I don't have one, because this is not about me. It's about her or him, depending on who I'm in the room with. I have to set myself aside always. But the facts remain facts. Self-suppression will lead to this. Self-suppression will lead to this. Cardiovascular disease, it will lead to autoimmune. It will lead to, having conditions of fertility. No one sat on their deathbed regretting taking a risk and trying. No one regretted on their deathbed doing their best to follow through and find themselves and be their best version of themselves. People regret not speaking their mind or following their hearts. So, to the degree this is helpful, I did a good job. To the degree I didn't, your comments are welcome. This is an important thing for me to do. I find great value in it for me personally. I really like doing this work. This is, doing this here with you is an extension of the work that I do in the room with my patients, and it helps me. It just means a lot to me. So if you like this episode, please press like. If my podcast is a good one for you, subscribe. And if you know someone that will benefit from the work that we're doing here, this episode today, please share it. Next time I'll be here, we will do more on fertility and the impact that self-silencing and self-repression has on fertility. We'll discuss those areas. And then, so thank you so much for tuning in, and I'll see you at the next episode.